Good afternoon. Hey, this is Dr. Berardi, and we have a patient that called in and said, who is a good candidate for plastic surgery? It's a fairly general question, but there's a few criteria. Some are specific to health, right? So if you have some ongoing medical conditions, depending on the type of condition, like a heart problem or a lung problem or a healing problem, well, we may deem you a candidate or we may deem you not a candidate, depending on surgical clearance. We have lots of patients with heart conditions, but as long as they're cleared by their cardiologist, generally it's safe to proceed for surgery. So medical conditions are the number one thing that we say, well, are you a surgical candidate? Next one is nicotine use. So for some patients that are using nicotine products, notice I didn't say smokers. So it used to be we worried about cigarettes. Now we worry about cigarettes, e-cigarettes, vaping, you name it. So it's the nicotine, not the smoke, that causes issues. And typically procedures like tummy tuck, facelift, breast lift, breast reduction are the procedures that we worry about most when it comes to nicotine use. Nicotine use decreases blood flow to the areas of the surgical site, which can lead to infection, but also can lead to tissue necrosis or death of tissue, which is not good, especially if you're going to undergo a aesthetic surgery. Beyond that, it's if someone comes in for a particular surgery, and sometimes we can deem them, say if they come in for a breast surgery. Well, there could be some physical findings that state they're not a good candidate for a breast surgery. Tummy tuck. So maybe, for example, someone comes in for liposuction of the abdomen. And liposuction, very common procedure, just like we're doing now. We're doing a little revisional liposuction. But if someone comes and said, oh, I want liposuction of my abdomen, and their skin is very loose and crepey, has lots of stretch marks, maybe their underlying abdominal wall is very loose and protrudes. Well, they're not necessarily a good liposuction candidate, but they might be a good candidate for a tummy tuck, right? Because liposuction is great to get rid of fat when the tissue is very elastic, but not when it's loose and full of kind of, let's say, stretch marks, crepiness. So they might be a better candidate for tummy tuck. So, so it's a somewhat relative to the desire that you want in your physical exam. Also medical conditions, status of smoking, and so forth is what determines whether you're a good surgical candidate or not. So thank you. Have a great afternoon.